Hi, my name is Dr. Andrew Butler. I'm a board-certified emergency physician, and I'm also the medical director here at 𝘊𝗿𝗍𝗄 ER and Urgent Care. I'm here answering your frequently asked questions about COVID-19. Let's jump in. One of the most frequently asked questions that we get, and frankly one where there's probably the most confusion, is how long do I need to quarantine for? And it's a really good question, and it's a tough question to answer because it really depends on your individual circumstances. So I'm going to break down the answer in a few different ways, really kind of depending on what most pertains to you. So if you were exposed to someone with COVID-19 or a person who may have had COVID-19, and especially if you were within 6 feet of that person for more than a minute, and even more so if either you, that person, or both were not wearing masks, then you should quarantine for at least 14 days. Why? Well, it takes an average of 10 days from the time someone is exposed until they develop symptoms if they're going to become sick, but it can take as many as 14 days. So if you haven't developed any symptoms after 14 days, you should probably go and get tested just to make sure that you're not somebody who's asymptomatic with it or carrying it for longer. But once you get to the end of those 14 days, probably you can stop quarantining at that point. If you're exposed to somebody with COVID-19 and you develop symptoms, you should get tested. Many people want to get tested right away after exposure. For example, your boss calls you up and says, "Oh, so-and-so at work tested positive. I want you to get tested as well." And it turns out that person tested positive 2 or 3 days ago, and that's the last time you were around them. Well, the reality is, as much as you want to get that answer right away, that's not the time to come in and get tested. You need to wait until it's been at least 10 to 14 days from the time of the exposure. And here's why. When you're encountering a virus, it takes a while for that virus to replicate, to cause more of itself in your body. And it has to get to the point where there's enough of that virus in your body for our test to be able to detect it. So if you're in contact with somebody with COVID and you develop it, it's going to be at least 10 to 14 days before there's enough virus in your body for that test to pick it up. So we don't want you coming in at, say, day 4 or day 8 and getting the test and that test being negative and you thinking I can go back to work, because it may be that you have the virus and there's just not enough there to detect. So what happens if you can't get tested? If you're exposed to somebody with COVID and you develop symptoms, or even if you don't, but you can't get tested, the CDC says again that you should quarantine 1, for at least 10 days from the start of your symptoms, and 2, for at least 3 days from the end of your symptoms, basically whichever is longer. I do want to talk about a couple of special circumstances because they're a little bit hard to figure, but they're super important. So number 1 is families, right? What do you do if you have a family and you test positive or somebody else in the family tests positive or gets symptoms that might be COVID? Well, first of all, of course, per CDC guidelines, the person who gets those symptoms or tests positive is supposed to quarantine for at least 10 days from the beginning of their symptoms and at least 3 days from the end of their symptoms. Keep in mind, though, that other family members can certainly get it, but it might then take another 10 to 14 days for them to even develop symptoms. So that's taking us out all the way to 24 days from the time that first person in the family develops symptoms. So what the recommendation is for families is the longer of either 24 days from the time the first person develops symptoms or 14 days from the time the last person's symptoms ended, whichever is longer. How about those who test positive but never have any symptoms? And those are lucky people, and it certainly does happen, but it can be confusing. What do I do? Well, you still do need to quarantine because even if you don't develop symptoms, you can still pass the virus on to other people. What the CDC says is if you test positive but you never had any symptoms, say you were sent in for a work test or just were curious and your test is positive, you need to quarantine for at least 10 days from the time you took your test. For those of you who are reaching the end of your quarantine time, based on those guidelines I talked about earlier, and you want to make absolutely sure that you're not contagious. Say you have elderly relatives that you want to visit, or you care for somebody who's got an immune compromising condition like cancer and they're on chemotherapy. Or say you want to go back to work and work with the public and really want to make sure you don't get anybody else sick. The CDC recommends that you then have 2 more COVID-19 tests, at least 24 hours apart, and that both of those tests be negative before you go back to those situations. And the reason is this, is that unfortunately, even though we do our best and we have these numbers to go by, the reality is that there are going to be some people who are still contagious after 14 days. And so you want to make sure, especially if you're in those circumstances, that you're not one of those people and giving it to somebody else.